Good morning, my name is Dr. B. I'm the founder of RE-DOX Skin Lab, and today's thought of the day are pores. But specifically, what can we do when pores become larger? And they inevitably do become larger as we become older. But interestingly, there is a sex bias to pores. Men tend to have larger pores than females do. But also, there is an ethnic and genetic bias as well. So if you're of Southeast Asian descent, your pores tend to be smaller than those who are of African descent. And pores are really interesting because they are one of the few hyper-responsive elements to skin androgens. So the topic really is, what can we do when pores become larger? And there are a few approaches. Some of those are, I guess, a little bit more extreme. So we have to really understand what pores are, and pores are just an external manifestation of what's happening beneath the skin, which are these glands that produce sebum. Sebum is known as oil, and so the larger the glands underneath the skin, then the larger the size of those pores. But also, larger glands tend to produce more oil. And so it stands to reason that larger pores are associated with oilier skin. But not to get too much into that side of things, the question is, what can we do when pores become larger? And indeed, there are things that we can do. And if you look at the interesting literature out there, retinoids have a really prominent role in reducing the size of pores, but it's how you take them. This is the interesting part. I'm just going to find a spot to see. So I mentioned that retinoids are one of those compounds that can act on those glands. They shrink the glands actually, and they do that by making the cells smaller, and they make those sebaceous glands, or at least the cells that make those sebaceous glands, less numerous. So the overall effect is that retinoids shrink the size of the glands underneath the pores. And when those glands shrink, the pores become smaller. And it's a long-term strategy. So it takes a while to work, but the effects are long-lasting. Even when you cease retinol use, those pores don't tend to, or they tend to stay that size for an extended period of time. So it's a pretty good strategy. But the question is, how do we take those retinoids? Because the scientific literature has shown that retinoids that we take orally, so we take that via the mouth, those seem to have the strongest effect. When you take those for a while, and talking many months and even years, the size of the sebaceous glands decreases, the size of pores decreases. However, most people don't take retinoids orally. And you need a pretty good reason to do so. And most people take them topically. And the question is, it's attractive to think that topically applied retinoids will act in the same way. And there isn't a lot of evidence to show that they do, at least not as effective as already taken retinoids. And the reason why is that when you apply a retinoid topically, about 80% of that retinoid compound stays at the surface of the skin. And very few, probably 10% or less, will actually make its way deep enough into the skin structures to act on those glands. So it's not to say that it doesn't work. Probably it is effective. Is it as effective as taking retinoids orally? No, probably not. Is it still a useful strategy to reduce your pores? We need to consider that when we take topical retinoids, we take them for a long period of time. And so is it a long-term viable strategy to reduce the size of your pores? Yes, I would say there's pretty good evidence to show that it is. And so that's the thought of today. How can we address the size of our pores? And retinoids seem to be a really good candidate for that, a really good choice. And I should preface this by saying that it includes all sorts of retinoids, topical retinoids in their retinoic acid form, but also retinoids that are in their less primitive state, like retinol. And the trick with topical agents, as with anything topical, it is the way in which it is formulated. It is the technology that is used sometimes to encapsulate those retinoids to make them more bioavailable to the skin. It is often the extent or the the amount of that compound in that formulation and how well it's preserved. So there are a lot of things to think about, and so it's really worthwhile if you're going down that topical retinoid route to address pore sizes to have a really good formulation to begin with. So that's all for today. Have a great day.